Okay, so I thought, given some of the incredibly interesting and useful contributions that I've seen on the discussion forum about the fat question that I left you, which was effectively to say whether or not it was strictly speaking correct to say that an area of fat doesn't stain. And you were quite correct. The vast majority of you who responded to this picked up on the point that in actual fact, the cell membrane itself will still stain very, very delicately. And of course, the nucleus, if it happens to be present on the plane of section that the tissue has been cut through, will also be visible. But it's the cytoplasm that doesn't stain because the fat has been removed in the processing. Some of you have also indicated this point that, of course, sometimes we do want to demonstrate fat in a section or in some cells, and if we want to do that, then we can use what's called special staining. So there are other stains that exist apart from hematoxylin and eosin, and this is an example of one here. What we're looking at here is a fine needle aspirate. So what's happened here is that a dog has had a mass in its skin. The vet has inserted a needle into this mass and has sucked out some cells and smeared them on a slide to try and achieve a diagnosis. This is called fine needle aspiration. And here we've got some of these cells that are residing in this mass on the dog. This mass was a lipoma. This is a benign type of tumour, so an overgrowth of fat cells, which is why we've got so many fat cells to look at here, which is nice to make the point that I'm trying to make here, which is that by dealing with this material differently, by not putting it through the normal processing, we are able to stain it with a different stain. This example here is called an oil red O for obvious reasons. The red means that it's staining fat cells, or the fat that we wouldn't normally be able to see on an H&E section is now staining this very bright red colour. So anything that's red in this preparation here is fat. So we've got fat within the cytoplasm of these cells, but you can still see what I'm pointing out to you here with the blue arrow. You can still see the nuclei here staining with hematoxylin around the outside of these cells, but in this example here we're seeing lots of fat. Most of it is held within cells. Some of the smearing here that you're seeing, these blobs that are not surrounded by a cell membrane and don't have a nucleus, these are just bits of fat that have been lost through a ruptured cell membrane onto this preparation here. But I just thought you might like to see an example of another type of stain which does highlight the fat in this example.